Good evening, everyone. I want to welcome you to our Speaking of Health lecture series. Tonight's lecture is called Preventing Falls, How to Be Safe. My name is Lisa Sakia. I'm with the Queen's Health Systems, and on behalf of Queen's, I'd like to welcome you all this evening. At this time, I'd like to introduce the first of our two speakers, and it is Dr. Sherry Cogan. Let's give her a round of applause. She is a geriatrician, and she is also the medical director of geriatric services here at the Queen's Medical Center. She got her Bachelor's of Arts degree in English Literature from Binghamton University. She graduated from Mount Sinai School of Medicine in New York. She completed her geriatric fellowship at the John A. Burns School of Medicine. She served in the Air Force and was honorably discharged as a major. She is board certified in internal medicine and geriatrics and is a fellow of the American College of Physicians. She has 3 children and enjoys doing yoga. And I always ask our speakers about this, what high school you went. So she went, why are we laughing here? She went to Wantagh High School in New York. Wantagh, anyone? Woohoo! Public school, woo, public school kids. I'd also like to introduce at this time, Corey Kojima. You could stand. She is a physical therapist here at the Queen's Medical Center, and she literally got her start here, as she was born at the Queen's Medical Center and raised in Mililani. She graduated from Mililani High School. She has a Bachelor's of Science degree and a Master's degree in physical therapy from California State University in Fresno. She has been with Queen since 1999 as an inpatient physical therapist, but is now an acute care physical therapist who she says she has been privileged to work on many floors, and especially she enjoys working with the geriatric population. Outside of work, she is married to Sean, has a son, and they just got a new puppy, a Yorkshire Terrier named Peanut. At this time, let's bring up Dr. Sherry Cogan and Corey Kojima.
Okay, welcome everybody. Thank you for coming out on such a rainy, icky, humid, I don't know how it could be kind of feel hot and cold at the same time, but it kind of does. So tonight we're going to talk about preventing falls. So are falls preventable? I mean, that would be the first question you'd ask, right? Is that really possible? And we kind of hedged and we said, yes, sort of. So we're going to try to talk about ways tonight that are the things that we can do to prevent falls, as long as we're all living on planet Earth with gravity. It's a little bit limited how much we can reduce falls, but there are definitely things we can do, besides all moving to the moon, where there's much less gravity. Although I heard Elon Musk just took...
He's selling seats to go to the moon.
He's selling tickets, and some Japanese billionaire just bought the first ticket to go out into space. Wait, whoops. What happened here? I think we have to go back a little bit. So tonight we'll talk about what is a fall, what are your risk factors, and the things that every individual can do to reduce their risk of falling. Corey.
Okay, so first of all, we want to define what a fall is. If you can see, you can read up here. The fall is formally defined as landing on a surface lower than what you have intended. So it's an unintentional landing on a lower surface. This is not a fall. But if I got up and I didn't mean to sit back on the chair, I've fallen. That's a fall onto a chair, but it's still technically a fall. Okay? I think one of the things we had talked about when we started this is we wanted to kind of be informal and fun, so if you have questions or thoughts, please ask.
So that means you don't have to fall on the ground?
You don't have to fall on the ground. Right, right. So this includes things like slipping or tripping or even passing out. So when we think about this topic, preventing falls, there are some things I'd like to ask you to ask yourself while you're sitting there. Number one, have you fallen in the past year? Have you had an unintentional descent to a lower surface? Think about that, the yes or no. Number two, were you hurt? If you did fall, were you hurt? Was it something where you had to come into the hospital and get checked out for? Or did you go see your doctor for something that might have happened? Number three, do you worry about falling? And does that worry impact what you decide to do during the day or how you perform your daily tasks? And then number four, do you feel unsteady when you're standing and walking? If you've answered yes to any of these four questions, then you might be at risk for falls. That doesn't mean it's the end of the world. There are things you can do about it, but just know, it's good to know your risk factors. Okay?
Okay, so when we talk about risks for falls, there are some things that we can't change. They're non-modifiable, and we're kind of stuck with them. So as we get older, it's more common to have falls. If we have certain illnesses that are not curable, we're more at risk for falls. But there's a lot of things that we can modify. So things like if we're very sedentary, things like the environment around us, our vision, medications, even whether we're socially isolated. If you have a strong social community, that may help you reduce your risk of falls. Weaknesses. If you said, oh, I went out to Long's and I bought myself a walker, but you never got anybody to train you to use it properly. And, ooh, sorry about this, but no bebas alcohol. Anytime we're drinking alcohol, clearly you guys understand that that's gonna impact your risk for falling, especially as we get older. So we're gonna dive a little deeper into some of the things that we can change tonight, and hopefully just really focus on 4 of them so that we can, you know, if we have too many things, nobody's going to remember anything. So the first thing is that we can sort of evaluate. Another way to evaluate your risk for fall is this test. We call it the TUG, or the timed get up and go. And Corey wants to kind of talk about that for a minute.
So the timed up and go test is something that your doctor or your physical therapist can do with you to assess your risk of falls. It's one of many tests that are out there. But this is one that is especially useful for seniors who are community dwelling. So meaning independent, living in the community, not in a nursing home, not being assessed in the hospital, but people who are actually out in the community. What the test involves is basically 2 seats, and then your therapist or your doctor will give you instructions. It starts like this. You sit on the chair with your back resting on the chair. When I say go, you stand, you walk, it's 10 meters, to the other chair and sit down. It's supposed to be 10 meters. And then sit down. Once you sit on the chair and your back touches the backrest again, the clock stops. So it's a timed test. We probably don't want to get up and run because that's not going to be accurate. We're going to ask you to do something that would be a normal pace. So when I say go, I'm going to demonstrate the test. Ready, set, go. Up, 10 meters.
10 feet.
10 feet, sorry. Turn and stop. Okay, stop.
Sorry.
So my time is 8 seconds. So what we're looking for is a time that's 12 seconds or lower. If you take more than 12 seconds to go from point A to point B, you're at risk for falls. And this is a studied test that other people have gone through. There are many other tests that they may put you through. Can you stand on one leg? Can you cross your arms? Can you close your eyes? But this is the timed up and go. This is especially useful for community dwelling elderly.
Shall we ask for a volunteer?
Is there a volunteer, anybody who would like to participate and do the timed up and go?
Yes, great. If you don't volunteer, I will call on you.
We have a prize. There's a prize. All right,
Yes,
come
ma'am.
on up.
Come on up.
Yay.
I'm one of those.
Yes, please, yeah.
Can I have one of our nursing students? one of our nursing students come and just walk?
What's your name?
Lily.
Lily? Come, Lily. Thank you for participating. I'm going to ask you to sit in the chair. And because I'm a physical therapist, I'm going to stay close by because we're paranoid and we like to make sure we keep our patients safe.
Wait,
Okay, where's my timer?
tell me when
Okay,
you're
so
ready.
Lily, do you remember the instructions?
I think so.
Okay, so when I say go, you'll stand, you'll walk to this chair, turn around, sit down. When your back hits the back of the chair, we'll stop the timer.
Should I not use my arms at all to brace? Or
You use whatever you need to do however it feels most comfortable.
Okay.
Okay, are you ready?
Okay.
Okay, ready, set, go. Stop. Oh, Lily blew me away. 6 seconds. So, thank you for participating. If Lily had taken longer than 12 seconds, or she tripped, and she looked like she wasn't going to make it, then she would be qualified as a risk for falls. Thank you for participating. Okay, nursing students.
So, for those of you that didn't participate, Lily got a T-shirt and a gift certificate for a new Mercedes.
Okay, so when you start an exercise program, because I'm the PT, we're going to be the ones that are really going to be cheering you on to do activities. Before you start any kind of formal activity, though, we always like to say, get it cleared with your doc. Make sure that your cardiac status is okay, that you're able to participate with an exercise program. Now, that being said, if you go to your doctor and you say, hey, I want to start an exercise program because I'm afraid of falling and I want to decrease my risk for falls, I want to go see a PT. Your doctor can give you a prescription. You can take that prescription just like you take any other prescription, and you can choose your clinic that you want to go to for physical therapy. Just like you could choose to go to Long's or to Walmart or to Target to fill your prescription, you can go to any therapist you choose as an outpatient. They'll do an assessment. They may test you with this. They're likely to check your range of motion or how well your joints move. They're likely to test your strength to see how strong you are. They're likely to test your sensation, your hearing, your vision, to make sure that these things are all working in coordination to keep your balance. If they find deficits, they can customize a program for you.
What if somebody's too weak to get out of the house to go to the clinic?
So if you're too weak, thank you for asking, your doctor can also order a home care therapy, which is where the therapist would come to the house. They don't come every day, but they would come, do an assessment, and then they may or may not keep you on service for a program. They may give you a homework and say, okay, this is what your deficits are. You've got weak quads and you don't have good range of motion in your knees. These are the exercises. I want you to do them 3 times a day for X amount of days, and they may just reassess you after that. Okay?
Okay, so the 4 things, and there'll be a quiz afterwards, that we're gonna try to drill into you today that you can do to prevent falls is 1, the exercise that Corey was just talking about, an exercise program. 2, having a doctor or a pharmacist review your medications. 3, having your vision checked. And 4, making your home safer. So memorize those. It's a memory test.
Okay, so going back onto the exercises.
Oh. Like that?
Try the next one.
You want the next one? No, you wanted this
No,
one.
I want that
No,
one.
you want this one.
No, I did that one.
You didn't say stick with it.
Oh, okay, sorry. So after you've seen your PT and after you've selected your appropriate exercise program, the main thing is you really got to stick with it. It's not where you're going to go to your PT and you're going to see them for an evaluation one time and then, ta-da, your balance is great. It's something you got to work at. It's something you really got to stick with it. And one of the easiest and best ways to stick with it is if you do it with a group. Okay? Pick something that is appropriate for your age and skill level. The UFC gyms are coming out everywhere now where they teach everybody how to fight and how to do MMA. That's not necessarily appropriate for falls prevention, but some of the other things we'll talk about later are more appropriate, like Tai Chi, or even, I don't know if you can see in this picture, but it's Obon dance. We just finished the summer, and summer is obong season. And why it's important, why we have this picture up, number one, it's culturally appropriate to Hawaii, and number two, it's exercise. Even though it has another purpose, if you remember, who did bon dance when they were young, or goes now? You remember? Dun, 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 right? You're stepping on one leg at a time. You're moving both your arms and your legs. You're moving forward. You're moving back. You're turning your head. All of those things are good for balance. Anything that makes you walk on an uneven surface helps you with your balance. Things that encourage you to change directions when you're turning around is going to also improve your balance. The other thing to think about is when you're standing on one foot. Walking, we always have to stand on one foot at a time. Always. When you're doing the dances, sometimes they have you standing on one foot for longer than one time. That also helps with your balance. So not only is it fun, it's good for your balance.
Wants to see her do that again. Can we have a round of applause? Anybody want to see her bone dance again?
So it's not just bon dance though, right? We're in Hawaii, we have tilinkling, we can do all these different kinds of things. It might not be like when we did it when we were in our 20s, but it's still valuable and it's still worthwhile. Even if you have to modify it and you cannot jump like you used to, it's still very, very appropriate. So dancing is a good one. Yoga is great for balance and exercise. You know, yoga is that low impact stretching. The better you get, you can stand on one leg. You know, those kinds of things encourage breathing. Oh. So yoga is another thing. And yoga, like, you don't have to be the master. You can do the modified yoga with the straps and the blocks. That is all great. Zumba is a little bit more upbeat, keeps you going with the music. As we were going through this list, we were like, okay, this is kind of a lot for the ladies. What about the men? Well, things like hiking. And you don't have to go hiking, you know, up Kalalau Trail. Just hike at Makapu, or even hike at Magic Island, somewhere outside. It's paved. It's going to give you a little bit of a challenge. If you get better, you get off the asphalt and you maybe go onto the grass or on the sand. Golfing. Any golfers? No golfers? Okay, golfing, right? I don't know how to golf, but you know, you take a stance, you shift your weight, you turn. It's all for balance. You're turning your head, your weight's going from one leg to the other. Golf is a good, expensive way to keep your balance up, right? And then, of course, there's like bowling. Bowling is not that cheap anymore, but same thing. Bowling is timing, right? It's strength, it's stepping, and at some point, you might end up standing on one leg. So these are all good activities, not just for socialization, but for strengthening and for balance.
It's not that part of the bowling that's the balance part. It's after you let go of the ball, and then you stand there and you go like this. Ooh, 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 no. And you try to get the ball to listen to you and go.
Or when the pin is going like this and you're jumping at the aisle. Okay. In Hawaii, we tried to figure out what was available to us here, and not necessarily something that's going to cost a lot of money. Department of Parks and Rec, the city and county, they have a lot of senior programs. I know for a fact that they have really dedicated people who come up with good activities for seniors, not just for socialization, but exercises and activities to keep people, you know, engaged and out in the community. The YMCA has formal classes that you can sign up for. Again, they don't have to be the really high intensity things, just the low intensity things. And a lot of times it's bringing the group together, age appropriateness, bringing people together to exercise. Tai Chi we'll go over in a little bit, but Tai Chi is a big one. Anybody does Tai Chi? Right? Good for your balance because it's slow and controlled. It's very graceful. And it's proven to help with your balance. Okay? The next thing that's coming up, we will hopefully see more in Hawaii, is a Matter of Balance program. The Matter of Balance program is something that is an evidence-based study that takes different components of fear of falling and falls for the community dwelling senior. So it brings people together. So it takes out the social isolation. It has formal exercises that they have people do. It also looks at nutrition and it looks at safety. So home safety assessments. And it brings small groups of seniors together. And that's something that you might want to look for coming in the future, because I know that there's some people out in the community that are working to bring Matter of Balance to Hawaii. Different kinds of gyms. Again, we talked about the UFC gym, YMCA, 24-hour fitness, those kinds of things. The thing I caution you with that is don't compare yourself to 27-year-olds and 30 years old who are doing really intensive exercise. Do your work, do your exercise, because that's what's going to benefit you most. We called, there's HMSA 365. Anybody who has HMSA, you can call or go to the website, and they have specific programs. HMSA 365 is that. And then the next one is Lanakila Senior Center, which is not far from here. They have a lot of senior programs for hula and different kinds of activities. So these are things that are available locally.
And this is not a comprehensive list. This was just a little tasting menu of what's around. Anybody doing any community programs for exercise that are not on this list? Yes, ma'am. Oh, she's trying for a second car. You know, we're saving the giveaway of the Tesla until the end. So, yes. What do you?
I go to a senior yoga class
Senior yoga. Where's that?
at the Moili Community Center.
Mo'iliili Community Center.
Yeah.
Perfect.
I go to the YMCA,
Mm-hmm.
Waikala.
Okay. Oh, the YWCA.
No, the YMCA.
Oh, the YMCA. Oh, okay. The YMCA. Okay, great. Anybody else doing any other exercise programs that they want to give a shout out to? Okay. So there's only, yes, ma'am.
There are free Tai Chi classes, 8 o'clock, Monday, Wednesday, and Friday at various churches.
Mm-hmm.
Monday is at Nuuanu Congregational, Wednesday is at Honolulu Community Church, and then Fridays at Harris Memorial. And they're all free.
Oh, wonderful. We like free. Free
yeah.
sounds good. Yeah, and then I sometimes see, like at Kapiolani Park, I see groups just meeting together, and I even see yoga groups meeting at the park sometimes. Okay. Corey's going to talk about Tai Chi.
Okay, so Tai Chi is the one that's the really getting popular right now. It's a really, really good program for overall balance and fitness. Not only the standing Tai Chi that you see that's really graceful and pretty that you see people doing, for people who can't stand for prolonged periods or whose balance really doesn't allow for standing Tai Chi, there's also seated Tai Chi that go through the same arm movements, because moving your arms is just as important. If you can't move your legs as well, moving your arms is just as important for maintaining your balance and keeping your overall health. So look out for those kinds of things as well.
And that could be like a first step.
Yes.
Or a,
And you can always progress from there. So the bottom line is to move more. If we look at our gentleman in the picture, he's up and he's walking with a cane, and you don't need to go fast, and you don't need to be power walking like Oprah, but get out there and do what you can. One of the things I did want to say with this slide is, use the device that's been recommended for you. I know a lot of people, I love one of them very dearly, who should be using an assistive device, but doesn't want to because it makes me look old. Or I don't like the way it works, and it's too cumbersome. The walker is too bulky. What I usually like to tell patients and families is, it's not forever. Maybe for now you need to use it. If you do need to use it forever, then you do. But it's always better to use the cane and to use the assistive device than it is to fall. Okay? One of the things that we often get asked is about the rollator or the four-wheel walker. This is a really nice device if you're not one who needs to lean on it. If you are someone who needs to lean on a device to take a step, this is probably not going to be your best bet. Because it's four-wheeled, it's very loose. This walker won't move unless you advance it. this walker could roll away from you. So if you're using a four-wheeler and you're needing to put weight on it, it might not be the best choice. It might actually put you at risk for falls. The other thing that we always try to remind people is it has a seat, which is great for you to rest if you get tired or if you get winded, but it's not a wheelchair. We've had a lot of people fall and get hurt using this as a wheelchair. So really, use your assistive device as it's been prescribed and intended. Okay.
And that said, I think Corey has some work I think you all have to do together now.
So, because this is a Prevent Falls and I'm your physical therapist speaking, I didn't feel good about just standing up here and talking. So what I wanted to do is have everybody stand and we'll do some basic exercises. Now, before you stand, if you feel like you're a little bit unsteady and you're not sure about yourself and you're on the hill, raise your hand because we have our beautiful nursing students who will come and who are actually going to keep an eye on you if you feel a little bit unsteady, because nobody is allowed to fall during this discussion. Okay, anybody want a beautiful nursing student to stand by them?
Back row.
Raise your hand.
Is she gonna make us coffee at the same time?
You can ask her.
I wouldn't say no to like an adorable young woman who wants to like come and
Yeah.
stand next to you.
Yeah. So nursing students, please keep your eyes open. Everybody's sitting in these chairs. So you have a chair that's available in front of you. What you'll see in the pictures, you'll see people holding chairs, which is fine if you're pretty steady. If you're not, and you're going to do these exercises at home, I like to tell people to hold on to the couch or hold on to the kitchen sink. Hold on to something that's not going to tip if you lose your balance. These are the beginning exercises. So this is a place to start. You can always modify these exercises under the guidance of your physical therapist to make it more challenging. And the ways you make things more challenging are to take out things that contribute to balance. So vision and then changing surfaces. But we're going to start with just the basics. So the first exercise...
Do you want music while we exercise?
Sure. So the first exercise is high marching. You can see in this picture, our demonstrating lady doesn't have a chair. If you have a chair in front of you, hold on to it. She's actually standing in a corner. And the reason she's standing in a corner is because if she loses her balance, she's in a place where if she were to lose her balance, she wouldn't likely get very injured. So I'm going to ask you to hold on, and I'm going to demonstrate this way. High marching is when you're going to lift up each foot one at a time, as high as you can, as is comfortable. Now the first one isn't going to be the one that's the highest. So think about just doing small marches. Think about clearing your feet. Think about using those muscles and shifting your weight side to side.
Are we ready to dance a little with it?
Sure.
Okay, here we go. Oops.
Hit it, DJ. Okay, so high marching. And it doesn't need to be fast. Okay. How are we doing, nursing students? Everybody looks good? Okay, next slide. Next exercise.
Next exercise. Oh, that's me.
Come on, Vanna.
Thank you. I kind of got in with the mute. Okay.
So hip abduction. So what we're going to be looking at is strengthening the outer parts of our hips. Why is this important? This is important because a lot of times we lose the strength in our hips, and it makes our base of support narrow. And the smaller our base of support is, the higher your risk for falls. So again, holding on to your chair, standing on one leg, all your toes are pointing forward. No toes pointing out to the side. All toes pointing forward. We're going to keep your trunk steady, and we're going to lift out, pause, and back down. Okay? Out, pause, and back down. When you're doing this, try to keep your hips even and down. Does anybody remember Mae West?
Yeah.
Okay, so Mae West did that thing, right, where she would kind of do that. My professor always told us Mae West has hip weakness because she couldn't keep her hip up. It wasn't to be sexy. It was because she was weak. Okay, so let's try that again. So toes pointing forward. Try switch legs.
Wait, are we ready to dance?
Yes. Okay, so let's start. Everybody start with your right leg. Okay? So lift out, pause, and down. Out, pause, and down. Out, pause, and down. Good. Out, pause, and down. Out, pause, and down. Okay, switch legs. Again, make sure all toes are pointing forward. Here we go. Out, pause, down. Out, pause, and down. Out, pause, down. Out, pause, and down. One more. Out, pause, and down. Okay, so that's the hip. Okay. Next one, Vanna. Heel lifts. So these are good. Anybody do these already? Okay. So these heel lifts are really good because they're going to strengthen our calves. And why do we need our calves? We need our calves because when we walk, our calves are the ones that help us to push forward. One of the things we know as we age is our steps tend to get smaller. And when you take smaller steps, we know that that places you at high risk for falls. So thinking about pushing forward and taking nice long strides is helpful in maintaining your balance. So heel lifts will help with that. Again, holding your chair, toes pointing forward, knees stay straight. We're going to lift up, hold, and down gently. Good. Up, hold, and down gently. If you want to get fancy, you can go up, hold, squeeze your okole muscles, and down gently. So you want to be controlled up and controlled down. If you notice you're starting to get shaky, you're starting to get tired, muscle fatigue. Okay, and if that's the case, then you stop and you rest and you do more later. Okay, but that's a good one, and especially if you can include the okole muscles. Ready? You like this one. Up and down, softly. Up and down, softly. Up and down. Now we're moving to the next slide. It's a variation of the same exercise. Now we're going to work on the muscles on the front of the calves. So the muscles that are responsible for lifting your toes up when you walk. Because if you don't have good, strong muscles with that, you can drag, your foot drags. And that's when you see people catch their toes. So the next exercise is going to be to stand and pull your toes up. Again, try to keep your knees straight. And then gently put your toes back down. So the forefoot of your comes up. And then back down. Good. Up. And back down. Couple more. Up. And back down. And then let's do this one with music. And we're going to include the heel lifts. So it's going to be a 2-for-1.
Okay.
Okay. So let's go. Heels up. Down gently. Toes up. Hold. Down gently. Again. Heels up. Hold. Down gently. Toes up. Hold. Down gently. Everybody's very serious. Toes, heels up. Hold. Down. Toes up. Good. And down. Couple more. Heels up. Down. Toes up. Good. One more. Heels up. Down. Toes up. Good. And down. Nice. Does anybody go to Las Vegas? So when you're on the airplane and you need to do some exercises and you're having to get that circulation going because we don't want to get any clots and you're holding, you can be nice to your neighbor in front of you and then you can do these exercises because that's also helpful. Okay?
How about when you're watching like Wheel of Fortune or the news?
So, when you're watching television or Korean dramas and they have all those commercials on, that's a great time to do your exercises. You don't have to set aside an hour to do your exercises, but work it in. Work it into something that you're already doing, like watching TV. Okay? Let's do the next one.
Okay.
So this is a little bit harder one. This is a single limb stance. What it is holding on to something for support and then just raising your foot and trying to hold that there. Keep yourself nice and steady. What we want to do is be able to hold your foot up and count. Hopefully you can do this for more than 20, 30 seconds. Okay? If you cannot, that's an indicator. That's another test that might tell you might benefit from using an assistive device. Okay? So let's try it.
Okay.
Hold your chair.
I didn't trust that I was me. Okay, so.
Okay. And then lift the right leg up. Count to 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Everybody steady. Now, switch legs. Hold. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Excellent. Good job. All right, just a couple more. Do you feel like you're getting warm? Like it's not so cold in here anymore, right?
I
Tap.
read the fine print when I signed up.
Okay.
Sir, just fill out the form in triplicate if you have any complaints, yeah.
My fault, my fault.
Tandem standing. So what this is going to be where you're actually standing heel to toe. So you keep your toe, one foot planted, pick up your other foot and put the heel so that it's touching. And then stand. Now this one I would hold on first, okay, and see where you're at. If you're noticing that this is happening, that might be that you have a little bit of weakness that needs to be worked on, okay? If you're finding that this is too hard, that you cannot go heel to toe, you might need to do a modified tandem stand where you kind of put your feet a little bit further apart. If that's you, you can work on this, and as you get better, you make your base more and more narrow. If this is a piece of cake for you, what you could do, you still hold on, but close your eyes and kind of feel where you are. Okay, nursing students, keep your eyes open now. But close your eyes and kind of feel where you are. You can kind of sense, am I starting to sway? Am I going back and forth? Are my knees starting to wibble and wobble? And are my ankles and are my toes trying to grab the ground? See, if you know that, then that's something else to notice, that maybe, you know, this is a good exercise to challenge your balance. Do it safely, holding on to something, but it's something that you can work on, because there's always things that we can work on to make us better. Okay, so that's the tandem stand.
Are we gonna do it?
We just did it. Do it?
Everybody do it?
Yeah? Okay.
All right.
Okay, this is a good one. This is the short squat. Holding on to the chair. What I'm gonna ask you to do is pretend like you're gonna sit and then change your mind and then come back up. Okay, so hold the chair.
Nope, we're gonna try it.
Ready? Here we go. We're gonna pretend we're gonna sit. Oh, change your mind, stand back up. Again. Pretend you're gonna sit. Change your mind, stand up. Now this time squeeze your butt at the top. And hold. Okay? Again. Start to sit. Oh, change your mind, go back up. And squeeze. Good. Again. Go down. Oh, change your mind, come back up. And squeeze. Try to avoid bowing, because we don't want the trunk to go down. We want the legs to bend. So if you're all looking up at me while we're doing this, we're good. Right? Let's do a few more. Bend. Change your mind, come back up. And squeeze. Bend. Change your mind, come back up. And squeeze. One more. Bend. Change your mind, come back up. And squeeze. Good job. Okay. I think this is the last exercise. Please sit down. Okay, so this last exercise is really for balance. So what it is sitting in the chair. Try not to have your back leaning. You can hold on to the chair, because this is something that if you don't know that you get dizzy, you want to hold on. Okay, so you're holding your chair, you're looking straight ahead, and then we're all going to look to the right, and then we're all going to look to the center, we're all going to look to the left, we're all going to look to the center. Okay, so this is good for your neck range of motion. Go to the right, and center, and left, and center, good, and right, and center, and left, and center. You might not be able to turn your head all the way, but as you work into it and as you do these exercises, you might notice that you're getting a greater range of motion in your neck. This is important because this is going to translate to when you're walking. and you're walking, and if you're at the mall or you're in Las Vegas, you want to be able to look around and see what's going on. And you want to be able to do that without losing your balance. So this is where you start. You would progress to doing it when you're standing. And then you progress to doing it while you're doing something dynamic. But all these things, you can progress with all of these exercises. So thank you for participating. This is the beginning. So try and keep these in mind. These are really basic exercises that almost anybody can do. Okay, so keep on moving. That's the bottom line. That's really what we want. Our bodies are meant to move. If we leave them sedentary, when we want them to move, they won't move as well as we would like. Okay, next.
Okay, so remember we had 4 things that we were going to work on to prevent falls. One is we were going to, does anybody want to say what the 4 things were?
Exercise. Next.
Medications. Thank you, ma'am. Okay, so medications was the next thing we were going to talk about. So to keep it really simple, the more medications you take, the higher your risk for falling down. Just the sheer number. But this does not mean you're supposed to stop all of your medications. The next section of this presentation, while we talk about medications, this is going to be a team effort. And your team is going to be you, your doctor, and your pharmacist, working together. Because we know that many of our medications, and people will tell it to me before I even tell it to them, they make me dizzy. They make my eyes blurry. They make me feel weak. I feel like I'm going to pass out. I get a little confused. So if we can simplify your medications, we can potentially reduce your risk of falling down. And as we get older, it's harder for your body to clear out medications, so less turns out to be more. So if anything, I'll make your life cheaper, which is also a good thing. So what I recommend is your part of this team project is to take all the medications that you take, all the prescriptions, all the over-the-counter medications, the eye drops, the suppositories, the patches, the medications that you got from your sister-in-law, the ones that are natural so they don't really count in your mind. Your liver thinks differently. The ones that you got from GNC, the ones that you got from Long's, the ones that you got from Times, the ones that you mail order, the ones that you got from Safeway, the ones that you got from Walgreens, the ones that you got from Walmart.
The ones that grandma gave you.
The ones that are still left over from your grandmother that have expired back in 1943. And you're going to put them all in a big bag, and you're going to bring them to your doctor, and you're going to ask them, you're going to ask your doctor, please schedule some time to go through all these medications with me and see where there's opportunities to make it more simple or safer or, just streamline. The other person that you could do this with is the pharmacist. The difference is the pharmacist may be able to make recommendations that then you bring back to your doctor, but ultimately your doctor's gonna know what health issues that you have and what you really still need to keep in terms of your medications, what medications have to stay on board. The other medication that I'm going to talk about is at the bottom of this slide. It's a liquid. Sometimes we mix it with Coca-Cola or tonic water. Anybody know what medication I'm talking about? Alcohol. So many people believe that alcohol is not a drug, it's a beverage, but let me tell you, as far as your liver is concerned, as far as your brain is concerned, as far as your kidneys are concerned, alcohol is a drug. And it's the one drug that we actually all classically think about in terms of falling down. We call it falling down drunk, or we know that many of us use alcohol just for the effect it has because it helps me fall asleep. So it makes you sleepy, Or I get a little giddy, and so it's funny, and so I like to relax with it. It makes me very relaxed. All of those factors make you at higher risk for falling down. If you've had a fall, if you feel unsteady on your feet, I'm going to tell you that this is one of the drugs that you probably have to eliminate. Yeah, I see a lot of that. Yeah.
Everybody got real serious.
Yeah.
All of a sudden.
It got real. It got real in here. And I would say, because we want you to have a good time and we want you to have fun and we want to make exercise fun, I would also say don't just eliminate alcohol. I would say substitute something that is lovely and celebratory and fun. For me, Martinelli's sparkling apple cider. It looks like a bottle of wine. It's fizzy like champagne. It's delicious, but no alcohol. Or for you, if it's like guava juice with a little spritz of soda in there, whatever. Put a little like mint leaf on the top, float an orchid in it. Do what you need to do to make it lovely, because you're not supposed to, this is not a punishment, right? If you were being punished, I would let you know. This is supposed to be something to keep you safer. And just to let you know, many of us just go through life not even thinking like, oh yeah, that sort of is a drug to my body. And so it's a little bit of a wake-up call to say, your body doesn't know that it's not a drug. Your body thinks it's a drug, and probably one of the more dangerous ones. Okay.
Moving.
Go on. Yeah, let's see what else. Okay. I would also say that before we move on, there are definitely certain classes of medications that are way more dangerous than others. And just because something is over the counter does not make it safer. As a matter of fact, some of the most dangerous drugs for fall risk are the ones over the counter. Anything for colds and flu and allergies, and to help you sleep, all the over-the-counter sleep medicines are probably the most dangerous in terms of fall risk. So those are the ones that we're going to have to find other substitutes for. Okay, and that's going to be the partnership between you and your doctor, maybe you and the pharmacist, maybe all three of you working it together to keep you upright. Okay, and down at night, but up in the day. Okay. Getting your vision checked. So how many people get their vision checked every year? Good. And every year there's new advances in surgeries, in glasses, in contact lenses, and all kinds of things. And as we age, we get more changes in our vision. Maybe our ability to focus changes, especially when you're at the age of 40, most people notice that they started to need reading glasses. Hello, look at me. And then as we get older, we may develop cataracts. We may develop, if we have diabetes or other conditions, we may get problems on the retina. And these should be addressed on a regular basis to keep your eyes healthy. If you're like me and you need reading glasses as well as distance glasses, and you have progressives or bifocals or trifocals, you need to be aware that when you look down at the ground will not be in focus if you're wearing bifocals. And
especially when you're climbing the stairs, right?
Especially going down the stairs.
And one of the things we know is we rely on, maybe I'll go on the other side, we rely on different systems for balance. If your system of vision is impaired and you're not aware of it, and you're starting to get ready to climb up or down the stairs, or you're on the curb and you're starting to walk down, and your eyes are telling you that the ground is there, but it's not, that's a risk for falls, right? If you're visually impaired and you have stairs at home, then you might need to start to rely on other systems, like using your arms for helping you with balance. You might need to use a sense of sensation, knowing where the step is, so that you can start to do things safely. Because those are different systems that are all going to play.
Yeah. So especially when you get new glasses, or if you get glasses that are multifocal, meaning there's reading on the bottom, middle distance, and then far distance, I'm going to remind you to be really, really cautious, especially on stairs, because maybe now your romance novel is in focus, but the ground will not be. And I got reading glasses because I like my food to be in focus. Food is very important to me, and when my spaghetti got blurry, I got very upset. Okay, home safety eval. I'm gonna let Corey talk about
Okay,
home
so
safety
there are handouts outside that our beautiful nursing students will be handing out or have handed out. There's this one of them. It's a check for safety. What this talks about is how to identify and eliminate fall risks in your home. Things as basic as moving long extension cords away. You'll hear that a lot. Or also even looking at your lighting, making sure you have appropriate lighting. Leaving a light on. If you're gonna be one of those people who gets up 7 times in the middle of the night to go to the bathroom, it might not be a bad investment to put a nightlight in there so that when you get up and we're all tired and groggy and maybe a little disoriented, you know where that you're going and that it's a clear area. Now that being said, a clear area means try to put the clutter away, including things like area rugs and plants and the grandkids' toys. We want to make sure that it's all out of the way so that it's not a fall risk. An occupational therapist and or a physical therapist can come to the home and do a home safety assessment. There's such a thing as called aging in place, where they can help you figure out what is appropriate for helping to keep seniors living in their home.
Okay. This was our cue. This was my cue, see the cue, to talk about other risk factors. Many people, by the time we get older, we have blood pressure problems, and many of us are on medication for high blood pressure. Anytime your blood pressure is either very, very high or too low can be a problem that may make you feel weak or dizzy or falling. In addition, if we've had lifelong high blood pressure or if we're a little dehydrated, your blood pressure may not keep up with you when you're going from either lying to sitting or sitting to standing. And even though we have a fancy name for it, you don't have to know that fancy name, orthostasis or orthostatic blood pressure, but it means that your blood pressure is not as fast as you are. And many people will tell me, ooh, when I first stand up, I'm dizzy or I'm lightheaded. And that's because your blood pressure is not as fast as you are. If that's a problem that you're having, we really recommend that you first of all, keep yourself well hydrated if that's okay with your doctor. If you don't have congestive heart failure or other issues that your doctor wants you to limit your fluids. But if it's okay with your doctor that you drink plenty of fluids, keep yourself hydrated and make those changes slowly. So when you stand up, you may want to be near something that you hold on to and then wait. And you'll know your own body, but oftentimes it can take actually up to a minute or two for your blood pressure to catch up with you. So we find a lot of people who have this problem actually fall in the bathroom because they get up from bed and they're sort of okay, and by the time they walk into the bathroom where they're going, then it hits them, whoa, and then out they go right where there's every hard surface. But it's easier to mop up the blood in there, so I guess that's why we were designed that way. So we do recommend taking those, if you know that that's you, first of all, you can ask your doctor to check that in the office. Check to see if your blood pressure is keeping up with you when you make changes. And then if you know and your doctor can work with you to try to overcome that problem. And if it still remains a problem, you may just have to take that change slowly, wait till that your blood pressure catches up with you, play some music, and then move away. Okay, what's next? And here's a little chart, and we have it out there, I believe, as one of the handouts, because this is such a common problem that it's out there for you, and you can even bring this little chart to your doctor's office, or many people these days have a home blood pressure kit, a home blood pressure monitor, and you can actually do this for yourself at home and bring the results to your doctor and say, hey, I checked this at home and these are the results that I got. And we want to make sure that not just we'll know that you're orthostatic if either your blood pressure drops when you stand up it just can't keep up with you. Like you need, like pilots taking off, need sometimes like to have pressure suits. Or if your pulse rate kind of tries to compensate and your pulse rate goes faster. And we have that as a handout outside.
Yes.
So you can measure that yourself at home. And then there's a lot of medical conditions that you need to talk to your doctor about because these can increase your risk for falling down. Certainly diabetes in many ways, it can cause that kind of blood pressure problem. It can give you numbness in your feet, so you're not getting that extra information about where's the ground, where's the stairs. It can affect vision. Because remember, falling is not a disease. It's not like, oh, you've got the gene for falling. Falling is what we would call a syndrome. It's the accumulation of lots and lots of different factors in your life that all kind of tip you towards going down. So vision, sensation, blood pressure, loss of balance. So diabetes affects eyes, the vision, sensation, it can affect blood pressure. If you're over-treating your sugars and you have low blood sugar because you're trying to be so careful, you can fall down. Arthritis, the most common condition as we get older. The most common condition, osteoarthritis, can make you feel stiff, make you move a little bit slower because of that, and therefore you can't react as quickly. Anyone who's had a stroke, so strokes obviously can give you weakness on one side, make you feel like you're falling. Parkinson's disease, very common in Hawaii. Has anyone ever seen someone with Parkinson's? They have that very small shuffling gait, and they can often like move so slowly that they can't compensate and can actually fall backwards, which is very dangerous. I'm going to move to depression. People who are depressed can fall down more often, not just from the medications, which can add to it, but just moving slowly, not being more sedentary, just not being as aware of the outside environment. So we ask you to, oh, look, I put alcoholism up there. Even if you say, I'm not an alcoholic, I'm going to kind of drill down on this one again. You don't have to be an alcoholic. And dementia, which is very, very common in our community, can make people less aware of their environment, have less safety awareness, think that they can do things that they're not supposed to do. And I'm going to put mango trees up on this list because people in Hawaii tend to get mango tree dementia, which is like, oh, I'm going to climb up in the tree even though I'm 84 and I have osteoporosis to get my mangoes. And when I say to people, and we have a trauma center here at Queens, so Corey and I see a lot of
mango trees.
What's the number one reason that our trauma service sees trauma victims in the ER? I'll give you choices. Gunshot wounds, car accidents, old people falling down. Who wants to vote for gunshot wounds? Nope, that's not the reason. Very good. Car accidents, maybe. We have a lot of traffic. Anybody going for car accidents? No, nobody's going for it. Old people falling down? Can I have a show of hands? Absolutely correct. That's what gets Dr. Steinemann's kids through private school. All those old people. And what do people do? They fall out of trees in Hawaii. Falling out of trees. I even had someone who fell out of a banana tree and said, that's not a real tree. It's like a modified grass. Why are you trying to climb it? Anyway, so do not get mango tree dementia.
Because the tree was there, that's why.
It was there, like Mount Everest. Okay, next. Because, like, nobody wants supermarket mangoes when you can have your own mangoes. Right. So sometimes this is not an illness, but actually we kind of, in geriatrics, we consider this an illness, fear of falling. This is a really important thing. Once people have fallen once, oftentimes they can develop a fear of falling. And just that fear in and of itself can make you more likely to fall in the future. In the hospital, I often see Corey working with patients and trying to get them to get up and stand up, and they are literally so afraid of falling that they're pushing backwards to the point that they're going to fall backwards.
Right.
It also makes people not want to get up because they're afraid of falling, and therefore their legs get even weaker, and it's a vicious downward spiral. So we really don't want people to fall because it makes them more likely to fall, and then it also creates more social isolation because people who have fear of falling don't want to go out and join a Tai Chi class. They don't want to go to the Y, and that social isolation is yet another risk factor for falling. Okay, can we go? Okay, if a fall occurs.
Okay, so one of the big questions that I get asked a lot, particularly from family members and caregivers after I've seen their loved one who's been in the hospital after they've fallen, is what do I do if they fall? Number one, if it's an unwitnessed fall, if you haven't seen them fall and you find them on the ground, don't touch them, call 911, because we don't know what happened to their head or their neck. So that's number one. If you walk in on a fall and you see somebody's falling and you grab them, then you can prevent the fall. Then you're okay. Then you just start yelling, help! Somebody give me a chair. Dr. Kogan's falling again. Okay? But if you're by yourself, what if I'm alone and I live by myself and I'm going to fall gracefully? So I've fallen. What do I do? That's the number one question. What do I do? What I usually tell patients and families is, number one, you got to try to stay calm. Your heart's going to be going 440 and your blood pressure is going to be going and you're going to be shaking and you're going to be shaken up. But try your best to stay calm. Look at where you're at. Look at your body. Is everything pointing the way it's supposed to be pointing? If things are not pointing the way they shouldn't be pointing, I wouldn't try to get up. I wouldn't try to pick up my loved one if I found them down and things were not where they were supposed to be. I would call for help, and that would be 911. But if I've fallen because I've had a beer and I shouldn't have, and I fall on the ground, and everything's pointing the way it's supposed to be, what do I do? Okay, so this is okay. Now I need to figure out how to get up. Now there's always more than one way to skin a cat, but there are different safe ways to do it. One thing you could do, if you can scoot and get to a chair or the bed or something that's stable. I'm going to go this way so I don't show you my okole. You can try and get here. Get onto the chair from here. Can I organize my legs from here? And then from this point, try and get onto the chair. That's one way of doing it. The other thing you could do is if you can't get up, you would scoot on your butt, and as long as it takes, right, to get to wherever the phone is, and you say, I've fallen, I need help. If you have a life alert, please push the life alert. You know how many people have the life alert? Anybody have a life alert? Okay, if you have a life alert and you fall, please push it. I've had so many people say, I didn't want to bother them. You pay them, bother them, okay? And we all have cell phones nowadays. If you've got your cell phone on you, they have really nice blinged out things you can put your cell phone in, you can keep it on you, and you can pick that out and call for help. But if I'm going to get up, I'm going to try and find something stable, for one. And maybe I only get this far, but this keeps me from being on the floor. Okay? If I can come up to my feet, I can turn around and then have a seat. If it's a bed or a couch, you can just get your whole body onto the couch. That's another way to recover after a fall. But always make sure that things are pointing the way they're supposed to be pointing, and there's not a lot of blood or fluids coming out. Because if there is, then I wouldn't try to get up by myself, and I wouldn't necessarily try to pick someone up. Why? Because if it's pointing the wrong way, you're probably injured, and if you try to bear weight on it, you can make it worse. Not only that, if there's fluids coming out and things are pointing the wrong way, when you get up, you might pass out and fall again, and we don't want that. And if you're the one that's coming in and you think, okay, I can help mom get up, or I can help you know, my sister get up, and you try to help her get up, and oh my God, she's really heavy, then you both end up down, which is really what we don't want. So that's the appropriate time to ask for help, call for help.
And we don't want you to lay on the floor for we see a lot of people who eventually get brought to the hospital who were laying on the floor for a very long time, several hours, sometimes several days. And they say, well, I just thought I would lay there and rest until I got stronger. They don't generally get stronger, and we don't want you lying on the floor for a long period of time. Laying on the floor is a risk factor for your muscles to break down, your kidneys to shut down, and if you wait too long, just the laying on the floor may be the end.
And
So,
if you're the one that fell, don't be hard head and say, don't take me to the doctor,
oh yeah.
okay?
I don't think this is the hard head audience. I think the hard headers are at home right now, on the floor.
Okay, so reviewing again, you can make small changes, but it all comes kind of back to those 4 things that we talked about. Talk to your doc and or your pharmacist to review your medications. Check your vision. Occupational therapist is listed here because we want to make sure we drive home the fact that you can make your environment safer. And then, of course, the last one is going to be physical therapy, which is where we want you to exercise and to move more. Okay? So again,
Wait, make this black and see if they remember.
how do I make it black?
You hit B.
Okay.
Ho ho. PowerPoint master. Ha ha ha. What are the 4 things that we want you to do? Exercise. Review your medications. Check your vision. And home safety.
Good job. Now how do I not make it black?
Unbe or be it again. Yeah.
Okay. Perfect. And I like this picture of this guy on the longboard, right? Obviously got good balance. I couldn't do that. Again, this is on some of the handouts outside. Gives you a little rundown and a synopsis of what we talked about today. This is a questionnaire that you can take to your doctor and say, hey, I took this questionnaire and I scored more than 4 points on this. I think I'm at risk for falls. Maybe we can work on it together.
Here's that tug test that we had that lovely volunteer help us with. And that's out there. And the blood pressure check that you can do for yourself at home or bring to your doctor. And we're just trying to get you guys to move more and be healthy and avoid falling down. So with that, I think we're ready for questions, if anybody has any questions. Yes, ma'am.
How do you use a cane properly?
Oh, that's a board question.
How do you use a cane properly? Okay, so the reason you use a cane is going to impact how you use a cane properly. First and foremost, if the cane is an appropriate device for you, meaning you've been assessed and this is what is appropriate for you, a lot of times it's going to depend what you're using it for. Of course, it's for balance, but is my balance compromised because one leg is shorter, because I have arthritis and I can't straighten out my knee? Or am I using the cane because I just need to make sure that I have something, because every so often I get a little tired and I want to lean on it? Generally speaking, the cane becomes like your third leg. You would use it to the side and you would advance it with each step. So it would be about a step that you would take forward. You can get fancy. You'll see people start to do things where they're going bam, 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 and they're walking really fast. Or you see people that do this, right? This is not the right way to use the cane, right? But typically it's a 3-point pattern. And it's usually walking this way. And it's a little bit slower, to be honest with you. It will slow you down. And sometimes this is what people need, is to slow down. Because you'll see people who are trying to rush. And sometimes you need that cane to slow you down.
We have a question over here.
Oh, I'm curious about this thing about wear shoes both inside and outside, avoid going barefoot or wearing slippers. What is that about?
Okay, so
Yeah, that ain't gonna happen in Hawaii, but.
culturally in Hawaii, we don't wear shoes. But if you think about it, I'm going to show you because you're far away. Look at the size of my foot here. And if I put my shoe on, how much bigger does my foot get? So you have that much more surface in contact with the ground, better odds for helping you to keep your balance. Now, in Hawaii, if I were to wear my shoes in the house, my mom would not be having that. But it's just something that, keep that in mind. The shoes that are attached to your feet, way better than rubber slippers, right? Because rubber slippers, we've all had the time when your heel slides off, when it's wet like outside and you're walking. So if the shoes are attached to your feet, that's also better. But it's
When you say attached to your feet, like laced up.
attached to your feet,
Or
yeah.
Velcroed up.
So you don't go pack when you're walking.
Yeah, and rubber slippers, there's always somebody walking behind you who gives you a flat tire by stepping on your slipper, and then you're like, right? Yeah, so slippers we don't generally recommend in Hawaii, and I see everybody wearing slippers, including people who should not at all be wearing slippers, like diabetics. If you're a diabetic, your feet should look very much like my feet right now. Closed shoes, socks and closed shoes. I'm not going to ask who's a diabetic because that's a HIPAA violation, but statistically speaking, there's about 30 of you in this audience right now, and diabetics must be wearing shoes and socks. Diabetics die from the foot up, we say. You have to protect those feet, and slippers are the last thing we want you in. And like Corey said, I feel much more steady in my shoes and socks.
Okay, we have a question here.
Right. If you had a stroke and the left or the right foot got affected, or say the left, where do you hold the cane?
Usually, so the question is, if you've had a stroke on one side or the other, where do you hold the cane? Usually you're going to hold the cane in the strong side. Because when you put your cane out, if my left side is the weak side, this is my weaker leg, I'm going to need that extra support when I'm bearing weight through the affected limb. So you would hold it in your non-affected arm.
Great question.
Okay, one more question here.
I can't remember all the exercises. Where can I find a list?
There's a lot of lists of a lot of exercises online for balance exercises for the elderly. I think we have some in the handouts as well. But I would recommend, if you're really interested in doing a program of exercise for your balance, I would strongly recommend trying to get to see a physical therapist so that you can have a customized exercise program. This is something generic that we can all kind of do because we know we're a community dwelling group. But if, you went to see a therapist and then we knew you had problems with like an ACL repair or you've had a hip replacement, it might change your exercise program a little bit. So it's best to get it customized.
When somebody falls down, is it appropriate to ask, where does it hurt? In other words, what part of your body does it hurt a lot so that I won't pick you up in the shoulder if that's what's bothering you?
I think it's appropriate to ask where they've been hurt, because if the ambulance comes, they're going to ask you where you're hurt. But if you take that a step further, should I be helping them to get up? I would venture to say probably not. I would leave that to the firemen and the EMS. Yeah.
Thank you.
Yeah.
Okay, other questions? Raise your hand.
Great.
Perfect.
Oh, okay. Someone wrote down a question.
Okay, this is from one of our viewers on the mainland. Oh, I need to tell you that some of our handouts ran out, but they can be found at the CDC website if you want to, because we use the Center for Disease Control handouts so that they're kind of universal. And the CDC website, which is, I think, cdc.gov, has all kinds of information and these handouts, which you can either print out or request for them to send them to you. Well, thank you guys. You're a really great audience.
No last questions? Wasn't this fantastic?
Thank you for participating, and we hope to see you not in the hospital.
We want to see you at Safeway or Costco, not in the ER.
Oh, wait. We have one more question. Hold on, one more question. Go ahead.
I have a friend who just fell, and he broke his ankle in 3 places. He broke his bone. And I was wondering, how much longer does it take a senior citizen to repair their bones versus a younger person?
Okay, well, that's a little bit of a complicated question, but you're absolutely right. I mean, the premise of your question is it will take longer as a senior citizen to knit your bones back together than for a younger person. So generally, and we would usually think like 8 weeks. Unfortunately, sometimes with seniors, if they have very, very brittle bones, sometimes they can't even be secured with hardware. So it gets very, very tricky. We really do not want you to fall and fracture. But generally, I would say sometimes kids, you can get them out of a cast in 4 to 6 weeks, and seniors sometimes like 8 to 12 weeks. So just don't.
That's why this talk is preventing falls. Don't fall.
Balance. Work on your balance. Okay.
Okay, how about another round of applause for Dr.
the
Sherry
audience.
Kogan and physical therapist Corey Kojima. Wasn't that wonderful? I also want to say mahalo to Maria Mariano, who is part of the falls prevention team here at Queens, and they were out there with the nursing students of Chaminade University who are presenting information for you. So let's give them a round of applause. And I also want to say mahalo to our volunteers, James Liu, who is helping tonight, along with Nicole Bowie and Kelsey Castellini. And, we'll give them a round of applause. And to let you know about our next Speaking of Health lecture next month, Dr. Kogan was mentioning osteoarthritis. It's going to be on osteoarthritis. It's called When Joints Disappoint, Getting a Grip on Osteoarthritis. And if you suffer from joint pain, you could have osteoarthritis, which is a degenerative condition that affects more than 30 million U.S. adults. We're going to have Dr. Scott Kawamoto, who is a rheumatologist at the Queens Medical Center, talking about the causes and risk factors, the symptoms and signs, his approach to diagnosis and treatment options. That is going to be Wednesday, October 24th. 6 to 7 p.m., October 24th, 2018, for those watching at home. And it's going to be right here at the Queens Conference Center. If you want to register, you can go online to queens.org, click classes and events, or call our Queens referral line at 691-7117. That is going to do it for us this evening. Make sure you get your parking tickets validated, just in case, and have a good, safe evening. Good night.